Guys, K-85 here, and today I'm going to start the last video in the first part of the cardiovascular system about all the blood vessels. So today we'll be talking about the anatomy of blood vessels today. We'll be talking about their main characteristics, the characteristics they differ on, and what their similarities and their similarities. Let's get into it. So all blood vessels have similarities, from the veins to the veins, which I circled, to the capillaries and the arteries. So they differ on some characteristics and traits like location, size, and function. So in arteries versus veins, the diameter of the cavity. As you can see in this picture, the veins, which are on the right, have a really large cavity. If I were to get it on the screen, it has way larger cavity, which is known as a lumen. It has a larger lumen. Oh, this diagram is hard to maneuver. Then the arteries lumen, which is smaller. So veins, because they have a wider lumen, they will have a thinner wall. And arteries have a thinner cavity, or a smaller cavity, I should say, but have a thicker wall surrounding it. So they have many similarities. Their outermost layers, like these layers over here, and these layers over here. I'm hovering my mouse cursor above these layers. The outermost layers are known as tunics. And the tunics have many names. The first and outermost one is Tunica Adventitia, over here. And then it has tissues like nerves, etc. Tunica Media has smooth muscle tissues. So we are going to do our muscular system later, but smooth muscle is used to move things along and it is used in the digestive system. We'll talk about it when we get there. Tunica Intima is the last of the three tunics. They have an elastic component, but keep in mind veins are not that elastic. And then the endothelium, which lines all of the blood vessels, like this pink area, it is the endothelium. And also here, the endothelium is the pink area. It lines all of the blood vessels, and even it lines the heart. It lines the heart, but it's called the endocardium in the heart. Now, there is a main difference when you look at veins and arteries side by side. It is that veins have valves. If we were to look at it like this. The reason veins have valves is to make sure that blood flows to the heart. They don't want veins to you don't want the blood in veins, which keep in mind is deoxygenated, to flow down. And you need valves because arteries can use the flow of gravity to get their blood to the cells. But veins, they have to fight gravity. So these valves assist blood flow. And if you exercise a lot, your muscles, when you contract them, the skeletal muscles, also you will learn when you start the muscular system, will help by contracting the veins, which contracts the valves. Okay. So we have gone over the anatomy of blood vessels and all of the parts of blood vessels and what their defining characteristics and what characteristics make them similar and different. I'll see you in the next video. I've already uploaded a position of the heart video, but this is the last video of all the arteries. So I will finish the heart, and then the plan is looking like we finish joints, and then we will start a whole new system, the muscular system. Thank you, and K-85 is out. Bye.